We believe that relationships are the foundation of everything we do. It's so important that we meet them where they're at because we know that decreases people's anxiety. They can listen and they can learn, and then they know how to care for themselves when they go home.
I think you have to relate to the patient. We want to find out everything we can about you to make your stay better.
We really wanted to make a hospital that was unique in the area. There are very many healthcare providers in this area, and we decided to focus on the experience that a patient would have when they came to our doors for the care that we rendered and make that unlike any other experience that a patient could have.
The Center for Disc Replacement, what we're about is empowering patients to be educated and find what works best for them.
The most common spontaneous comment I get from my disc patients is, "You gave me my life back." It is remarkable how it has shifted the midpoint of the average patient from a fusion, which is really good, to the disc replacement patients, which are exceptionally good. Many of the patients who come to us are candidates for both a fusion or a disc replacement, both in the lumbar spine and the cervical spine. But the price we pay with the fusion is loss of motion at that segment. With the disc replacement in either place, the advantage is those segments continue to move and will help preserve the remaining spine.
Well, compared to fusion, the recovery time is about twice as fast. The biggest distinction is that there is anywhere between a third to a fourth less chance of needing another operation in the future comparing disc replacement to fusion.
What we try to do is to make it like a concierge service. So when a patient from out of state or out of the country contacts us, we try to make all the arrangements for them, and then they're greeted by smiling faces. So they're greeted by people that really care about them, that our main goal is to make the patient feel good, and if they end up having surgery, we want them to feel like they've been treated like a family of providers.
We all become a family. By the time they leave us, they're usually laughing and they know our names and they really have a good time. We believe that a calming environment is a healing environment.
Our goal is to get you back to your daily life as quickly and comfortable as possible. I'm going to take care of you the same way I would take care of my family.
We actually did the first lumbar disc replacements in the United States here. We were among the first to do the cervical disc replacements. We have published the primary papers on the results of both lumbar and cervical disc replacement and the long-term follow-up. So this has been a big part of our lives for the last 15 years. And the three doctors at the Center for Disc Replacement have really been at the leading edge of academics. And we are known worldwide, we're respected worldwide because of our publications. We teach surgeons from all over the world, and we are invited to give lectures all over the world.
If your quality of life has been significantly affected and you've given up the things that you love and enjoy, you owe it to yourself. So see if you're a candidate for disc replacement, because it can be a life-changing operation.